think in the discussions about how the food environment impacts health outcomes, there's probably no term more hotly debated than the term food deserts. Some people think that food deserts and food access are primary drivers of health inequities, whereas other people say that it's not really about the space in which you live and your access to food in the nearby area. So I'm really pleased that we have this panel of experts here today to weigh in on the topic. To my left is Eli Zigas, who is Food Systems and Urban Agriculture Manager at SPUR. Maureen Silva, who is Program Coordinator at the Prevention Institute. And Dana Harvey, who is the Executive Director of Mandela Marketplace. So I'll start with the big question, which is, are food deserts and food swamps real? And if so, how do they primarily impact childhood obesity? And anyone can start who would like to.
I'm starting apparently. Can everyone hear me okay? No? Closer? Does that work? Okay. So at Prevention Institute, just to give you a little flavor of what we do, we have the unique opportunity of being able to not necessarily work with communities on the ground day to day, but we work with local health departments nationally and throughout the state, in addition to community-based organizations and communities, to provide technical assistance and training. And what we've learned through these partnerships is we get to hear stories, and a lot of the stories that we've heard really speak to food insecurity and what a lot of these communities are dealing with on a day-to-day basis in terms of health. And so when we talk about food deserts and food swamps, one thing that comes to mind is these are very different issues. When we talk about deserts, it's usually characterized by low-income or rural areas where there's lack of access to grocery stores, and oftentimes I think it's over a mile, and in some communities it takes them over 10 miles to get to a grocery store. When we talk about food swamps, this is when we see communities a lot of the time in urban environments that are, they have unhealthy and healthy food choices, but the unhealthy food choices really swamp out a lot of the healthy food. So there are some differences, I think, in how we characterize food insecurity based on what areas we're looking at. One other thing that I wanted to point out when we talk about dealing with the problem is we tend to think of childhood obesity as the problem, but we also need to be thinking about community solutions as part of the real issue when looking at childhood obesity. At Prevention Institute, we're very intentional about not using the word obesity when we're talking about chronic disease. And the reason for that is because it places a lot of responsibility on the shoulders of individuals. What we really need to start thinking about are these community solutions, which point to bringing in healthier foods to the retail environment. And that can be supermarkets, bringing in healthier foods to corner stores. And as our keynote mentioned earlier, equity is a huge part of this as well. We cannot thoroughly address childhood obesity, diet-related chronic disease among children without thinking about equity as the main concern. We know that in food deserts and food insecure areas, there's a lack of access to healthy foods, and that really kind of centers around communities of color and low-income communities. So to be able to do that, we really need to start shifting our thinking and shifting our approach to look at those solutions with equity in mind when looking at the retail food environment.
So I'd say the short answer is yes, they're real. Food deserts and food swamps, and they're important to consider, but they only tell part of the story. So my name is Eli Zigas. I work in an organization called SPUR. We work on good planning, good government. We're a mix of a think tank and an advocacy organization. We focus on local and city government policy here in the Bay Area. And we just published this report a couple weeks ago called Healthy Food Within Reach. And it's an example of the sort of work we do in the sense of bringing a task force of people together to look at an issue and consider how should local city governments, in this case, the county governments, work to improve food access, healthy food access for local residents. And out of that process, and building on the work of Heather Wooten of Change Lab Solutions, the one thing I really want to impart is when we think about food access broadly, that there are four types of barriers for why people may not be eating healthy food. So the one we're talking about right now is physical. Can you find healthy food? Is it available to you? The second, even if you can find it, and Charlotte mentioned this and many others have, is can you afford it? So even if you can find it, it doesn't really matter unless you can afford it, a healthy option. The third is, let's say you can find it, you can afford it. Do you know what to do with it? Do you know how to make a healthy choice and or how to cook? And so that's an educational barrier. And then the last one is a catch-all that we call cultural, but is really about demand. So you can find the food, you can afford the food, you know what to do with it, do you want it? And that can take the shape of a kid who really likes pizza, and you're trying to get them excited about a salad or vegetables, and you're like, no way. The other could be your cultural foodway. The food you're used to eating from wherever you're from or your family is not being offered to you or is not available, and therefore you don't even want to eat if you know how to find it before you eat it. So, I was talking to Charlotte after her presentation. Certainly when we think about food deserts or food swamps, the physical food environment has a relationship to what people are eating. And I'd say CCPHA has shown there's a correlation. That if you're in an environment where there's lots of fast food and corner stores offering junk food, there's a correlation between the people living in those neighborhoods having poorer health outcomes. But it's not a causation, and I think it's really important to keep in mind that people are making choices not just on what's physically available. So when we look at grocery stores, if you take away the junk food, if you just look at food deserts, if you brought a grocery store into a neighborhood, that's not necessarily going to solve the problem. And those of you familiar with San Francisco, Fresh and Easy moved into the Bayview, and we could debate how well their offerings matched what the community wanted, but it's gone now. It was there for a couple of years, and then Fresh and Easy went bankrupt. And there's a whole lot of factors in there. But you can bring a grocery store into a neighborhood, and people may not choose to shop there, because people don't choose where to shop solely based on convenience. They choose where to shop based on price, they choose where to shop on product mix, whether they're offering what we want, and then also convenience. And so the maps that you've seen, when you see what's called like a heat map, putting a grocery store in a place that's really red would make that map look more green. But I would argue that's not going to necessarily solve the problem. And so when we think about food access and deserts and swamps, there's only one barrier, the physical side, and we need to be thinking about all the barriers.
Well, we're just on the first question, so I'm not going to say a whole lot other than I think that both of you, what you said is well said. We are practitioners, so we're a little different. We're on the ground. I think there are some other issues around, it's easy for us to say food desert. We sort of understand that vernacular. We know what we're talking about, but when we get deeper in the definition, what we're seeing is that there are communities that have been intentionally disinvested in. And so there's structural barriers just around so many levels of not only access to food, but information, economy, transportation, stress management. So there's a lot of levels that we're looking at when we talk about looking at a food insecure community. I think the only thing I would add to what you both said is that, in our opinion, bringing in a grocery store is never a solution. But building the skills of the residents in the community so that they can map the solution, and then we can resource them to actually own and actualize that solution is a better approach than bringing in a store. So how do we grow stores? How do we grow the solutions from within the community itself?
Great, thank you. Maureen, what do you see as the relationship between state-level policy efforts and local initiatives aimed to improve food environments?
So at Prevention Institute, as I mentioned before, one of the ways that we engage across the state is through these local and statewide partnerships. And one thing that we've learned is that not only is policy for this key driver in making long-term sustainable changes to the food environment, but we also know that sometimes these local efforts can bubble up into statewide policy efforts. So it's twofold in that way. We know that education is extremely important, but in a lot of the efforts that we've seen locally and across the state, we cannot just have education alone. We need these strategies to be backed by policy. One way that Prevention Institute has really kind of started to think about this more with our partnerships is when we put on a policy advocacy day called Enact Day. Maybe some of you have heard of it. You see a couple head nods. And it's a statewide policy advocacy day that we put on every year, and it's around advocating for bills that are around nutrition and physical activity. So we choose about 4 bills each year, and we invite community residents, youth, local leaders, our community-based partners all over the state to come to this day in Sacramento to talk to their legislator. And one story that really resonated with me last year, there was a gentleman from Baldwin Park, who's an older Latino gentleman, and he talked about his struggle with type 2 diabetes. And he said that each day is really hard for him. He has to deal with this disease. And he tries really, really hard to try to get his children and his grandchildren and other folks in his community to eat better. But there's only so much he can do. He can't do this alone. And he said it's really hard when there's all of these forces that are working against his efforts in his community to try to help his children and his grandchildren eat healthier foods. And he was like, I don't want my kids to have this life. I don't want them to struggle with diabetes, but there's too much against me. And he said the reason why he was there at Enact Day was to be advocating for policy. This specific policy was for the soda warning label. And he just said, we can do all the education in the world, but policy is where it's at. We have seen through tobacco policy, through the laws that we put for car seats and seatbelts, that prevention policy works. And we need to start doing a better job with communities, with our local leaders, with government and corporate partners to be able to really push policy in that direction.
Thank you. My next question is for Dana. Eli alluded to this, and you did as well, the issue of creating demand for healthy food or for grocery stores that come into vulnerable neighborhoods. And I'm wondering your experience with Mandela Marketplace, what challenges you've had in creating demand and how you've overcome those.
That's a really complicated question. I think, so I checked in with community members before I came today so that I knew that I was giving you answers that weren't just mine. I think that engaging the community is the first step. But that engagement really needs to be followed up by action. So I know that there's a lot of money that's funneled into our organizations to do meetings and planning and let's address the issue, let's figure out a solution. And we always want community at the table, but after that process, we need to be prepared to actualize what the solutions are that they ask for. So I think that was a challenge at Mandela Marketplace. We spent a year working with a whole community of people and asking them, how do you create a food secure community? And the answer was very dimensional. It went to the source. We had to work with minority farmers. We had to have our own distribution center. We had to have a community-owned grocery store. We had to work with businesses, local businesses in the community. And these were all the solutions that the residents themselves presented. So at the end of that, we were left with, oh my gosh, we have a lot of work to do. So trying to develop a strategic plan to implement 5 different programs has been a challenge. I think that there's very real racial and structural barriers to low-income and low-access communities to accessing resources to solve their problems. And so that's a challenge that we face even now, and even through our own nonprofit, we have a real challenge accessing the resources that we need to do our work because there's not a lot of credibility placed on the fact that low-income people and people of color can successfully operate the solutions that we present and put in place. Let's see if there's any. I think there's a lot of stigma. So there's a huge challenge that there's a stigma that poor people don't want to eat healthy food, and they do. And when we had focus groups with homeless people, they complained that there wasn't a place for them to get apples. So this was really inspiring for us to change our perspective. There's also this that, well, we'll just bring in Foods Co. and that'll solve the problem. But the food that they're bringing in is really unhealthy. So if we're looking at it from the source and we're saying we're going to bring in conventionally farmed produce to serve to poor people because it's cheaper, it's okay that they're eating these poisons, then we're not holding true to our values. So I think that's a challenge. How do we get sustainably farmed, healthy foods to them at an affordable price? So I could go on for the rest of the session. I'll be quiet now, but those are just some, and I'm happy to share more.
Thank you. Eli, what role do you think urban agriculture can play in childhood obesity prevention?
Again, the short answer on that, I think, is mostly education. That I think when it comes to food access, and healthy food access, the real role of urban agriculture is teaching people and less so about feeding people. And I will argue till I'm blue in the face that we should have more space for city gardening and farming in backyards, and there are lots of initiatives going on. I'm a gardener myself, and I've been advocating for that in San Francisco for a long time. But for this audience, I really want to temper some enthusiasm I hear about urban agriculture as being a cure-all. It's not, and we should be realistic about what we can do in gardens and farms. And for the people who have backyard container boxes, or if they have a plot like I do at a community garden, you can produce quite a bit of food for yourself, for sure. And I don't want to take away from that. But if we look at it at a neighborhood scale or a city scale, we're not going to feed a lot of people with urban agriculture, and we shouldn't try. We should try and teach a lot of people. And so how many of you here are connected to school gardens or teaching gardens? That's awesome. Please keep doing what you're doing. What I've heard from garden educators is that children are much more likely to eat a carrot that they've grown. And there's a lot of food literacy that comes with that lasts throughout their lifetime. So both in school settings and in demonstration gardens outside of school, to me that's how we teach people, that educational barrier. What is healthy food? How do you make a healthy choice? And maybe how do you get more excited about it? And that we look at it less as this is the solution for how people will afford their own food, because I think only a small number of people will be able to do that.
Great.
Add something. I think also what I've seen being a community organizer, or community gardens are a really important way to bring a community together. And when we're working in the soil together, we're building a beautiful space. And it doesn't have to always be food. And I think we're always so focused on food. It could be flowers or herbs or, but having a park, having a green space that we come together around is a really important way to bring community together.
Thank you. My next question is for Maureen. How do you think that community design impacts the retail food environment of a neighborhood?
So this is definitely, I think, a topic. I'm glad to see that it was well covered, with Charlotte's keynote. And I'll try not to repeat a lot of her points, but more just reiterate some of the key points that I felt were important. Community design, I think, when we talk about the food retail environment, sometimes that word can seem very siloed when we think about all of the other factors in the environment, but I think they play a very important role in really being able to establish a connection with the community and being able to get them to eat healthier. I feel like sometimes I end up telling a lot of stories, so I apologize. I feel like it resonates more with me and it helps to kind of paint a picture. But one story that also I felt was important, we had a training in LA fairly recently, and we had community members and local health department and other leaders that were there. And one woman said, I know how to feed my kids. I know I'm supposed to be having them, play outside, eat better. But when I go outside, I don't see any of that. I don't see a playground that they can play in. I don't see a grocery store that we can walk to and get healthy foods. And so by kind of addressing this issue, it starts to help us think, what is really some of the problems here? And it helps us really think about taking 2 steps back when we think about childhood obesity, we need to be thinking about, well, what is it that's not allowing people to get to their local corner store or grocery store to get fruits and vegetables? What other tactics are at play here with big business that's helping people or shaping people's behavior? So we really start to see that the food environment helps shape norms, and I think the three really important parts to highlight in the community design is first transportation, the perception of safety and violence in a community, and also food marketing. And when we think about transportation, oftentimes that work becomes very siloed. We think of transportation as very separate, but we need to make sure that people are able to get to their local grocery store, their corner store, that there's paths for walking and biking, that streets are well lit, that there's active transportation and public transit that's of quality for people to get to those places. When we think about safety, even the perception of safety can not allow people to go to their grocery store if they don't feel like it's safe to walk at night. So implementing, proper lighting and really having the community involved in zoning and land use practices of where those stores are going, I think is really important. And then lastly, with food marketing, that work again becomes very siloed, but it can also create the norms in which people eat in the communities and the neighborhoods in which they live. So if we know that African American communities and Latino communities are targeted by unhealthy food marketers, that's going to shape the types of foods that they buy in their communities. So we need to be sure that there's practices that are happening around, limiting fast food promotional materials to kids, and making sure that billboards are not always just marketing unhealthy foods and tobacco and alcohol. So these are also things that we need to really think about as a way that shapes the food environment.
Can I add?
Definitely.
The other piece in thinking about community design is who owns the economy in that community. So if we are beginning to shift the dynamics of poverty, then we are providing opportunity for the residents themselves to change their quality of life. So if they own the business and they work in the business and they make a living, then it begins to actually reshape the entire neighborhood. And food is actually a very important economic catalyst. It can't be the whole economy in the community, but when you have a neighborhood-owned grocery store and you begin local economies of value-added products that are then sold in the community, it catalyzes a lot of other local businesses.
That actually leads into my next question for you, which is, what are some strategies, or how do you think about engaging parents and community members to take an active role in changing the food environment?
Yeah, and so this is one point, and I want to make sure I get this in before the end of our panel, is how clinicians and healthcare workers can support exactly that. So I think engaging the community, again, it's a lot about when you're organizing people and asking them what their needs and gaps are, that you are able to then present and actualize what they say they need. And so I think that that's an important way. Doing outreach and education is really important. Who's doing the education is very important. So who is it that is at the store telling moms how they can shop on a budget? If it's me, that message is going to be received differently than if it's Farmer Leroy who's sitting outside and has been a farmer forever. So, I think that that's something to think about. And one of the things, so we've had great success with setting up like tables in front of corner stores. We operate produce stands. We have the grocery store where community members, when they're in their normal pattern of their day-to-day life, happen to walk by, and so you have an opportunity to engage them in some discussion or some education. So I think that that's a really important way as well, where we're not taking people to a classroom or we're taking them to a workshop, but it's happening right there all the time. So one of the things that we're doing now with Highland Hospital is trying to find mechanisms for hospital staff to actually be education and outreach workers in the community at the stores, so that we can begin to have, we have community policing. I'm thinking of having, community doctoring, or, where, healthcare workers are actually in the neighborhood talking to people every day, where they are.
Thank you. Eli, what tools do you think that policymakers have for influencing the mix of retail options, food retail options in a neighborhood, and how can we think about those tools as far as changing food access and health outcomes?
So when I hear the question, it makes me think like the physical access side. What can government do? And I think there are a number of tools. We talk about them in the report, so I won't get into super detail, but they include zoning, that big picture, what's allowed in certain places and what's not, development agreements. If there's a really large development like there is going to be in Schlage Lock in the southern part of San Francisco, there's a clause in that development agreement with the city that says you can't move to the second phase of your development until you have shown pretty much that there's a grocery store ready to go, which is an innovative way of putting the risk more on the developer than just on the city and the community. Funding and financing, so grants and loans, can be one way of doing that. I would say the best practice that we saw was if you're going to give a grant to, say, a corner store, you might want to do it more as a loan that's forgivable after a few years, which is what Healthy Retail SF is doing, but to have the retailer have some skin in the game, because there's a history of here's a refrigerator case and it's used for healthy food for the first few years, and then after that the program ends and then it's stocking beer or soda or something else. So really making sure that any retailer that's participating and getting assistance is all in by them having some skin in the game. There are procurement policies. I think Charlotte talked about that. What's available, especially on public land. So do you have vending machines that are selling soda or not? What kinds of products do your concessionaires sell? Those are all tools that government has to influence food retail. Some of them work much quicker than others. Zoning is would lead to slow changes over time. Some of the other ones are much quicker. But then I'd also say there's a whole category of government policy that doesn't talk about the physical availability, which is really the supply of healthy food, but a whole set of tools related to demand for healthy food. And I think Dana was just talking about a few of them. Probably the biggest one is what policies do we have big picture to help increase purchasing power? So that could be minimum wage, that could be encouraging ownership and asset building in a lot of different ways. Demand can be shaped by soda taxes. Demand can be shaped by marketing regulation, menu labeling. So there's government tools on the supply side, but like I was mentioning before, we need to think also about the demand side and not just supply, and there's a set of tools for that as well.
I would say one really important government tool that we advocate for is that we begin to encourage our governments to redirect resources to human capital investment. So if we're going to put a grocery store in, then we know that there's a front-end cost that is really the responsibility of our tax dollars because of all the disinvestment that the communities that we're talking about have suffered. So let's direct those dollars to do the engagement process, to do the skills building and the training process, to begin to, I was really happy Charlotte used the word equity, to begin to create an equity bridge to bring people from a level of generations of disinvestment to a place where they can at least be at least on the same playground. So I think that that's another really important place where public dollars could be used.
Thank you. My last question is for everyone on the panel. Creating healthy food access is most likely going to involve or require collaboration across a number of sectors. And I'm wondering how you think that the health sector in particular should be working with policymakers, with advocates, with business members to bring about changes to food access.
I'll take a stab. You might have all noticed we've got these questions in advance, so we're just coming up with quick answers off the top of the head. I have 4 things. How many of you all work in an institution that's connected at all to economists? Yeah. Okay, so that's a partnership I think we could really benefit from, because you all as health advocates know that an ounce of prevention is worth a pound of cure. And I'd really like more people to make the case that $1 of prevention is worth 100 in the ER. And I think if we can say $2 million spent on increasing outreach so everyone who's eligible for CalFresh gets on CalFresh is going to be actually save you money, so people who have chronic disease conditions aren't being in the ER for 2 nights every 3 months. Because it probably works out better. And there's just not a lot of great data that I've seen on that. And those numbers speak really well to policymakers, because they're trying to figure out where to put their budget dollars. So, if any of you work in institutions that could have a relationship with economists, and you know patients, and you can say, I can show you over time, or we can find a group of people to do a study that shows you the savings if they're eating better, if their chronic conditions or otherwise are being prevented from getting worse, and therefore saving the public health system this much money, that would be gold for me and for other advocates. Other connections, your friends. I'm really struck by the bigger picture videos. The only reason the soda taxes in Berkeley and San Francisco are getting majorities is because there's a cultural shift where people no longer feel like, oh, this is just about personal choice. There's a bigger system, and we need to influence the way people think about it. This is more serious than I thought. So share those videos. Go home, go on Facebook, send an email, send a link to those videos to at least 2 friends. You guys willing to do that today? 2 friends? Okay, cool. If any of you are connected or know through friends of friends or otherwise policymakers, they're not thinking about this all the time. Some of them are, most of them aren't. They have a lot of things to think about. Get in their face, not in a bad way, in a good way. Set up a meeting, present them some ideas. And there's some great groups you can plug in: the San Francisco Food Security Task Force, the Open Food Policy Council, the Santa Clara County Food Systems Alliance. A lot of groups that already exist that you can work with to do that. And then the last I'd say is we need some better evaluations of some of these programs. So I think corner store conversions have a lot of potential. There's just on the quality of life, I think it's very clear someone doesn't have to go as far to find healthier food. But on the health outcomes, that's a hard study to do over time. It's a long-term study, it's hard to do with controls, it's a lot of surveys of dietary intake. So the health community partnering with groups that are doing these to do some more gold standard studies to know whether that's a good investment of public dollars would be really helpful. So those are the 4 ways.
Passing the mic this way, apparently. So obviously I come to this work looking at this from a health perspective, but I just wanted to reiterate the importance of having these community-based partnerships. There's really not enough that communities can do to really lift up health or health-related issues that can, affect childhood obesity and other diet-related chronic disease that we're seeing more and more in children. But the one piece that I probably want to focus on more is the importance of utilizing partnerships within healthcare. We've seen with the Affordable Care Act, there's been this recent investment in prevention, and we have piggybacked off of the patient-centered medical homes model to come up with and develop a model that we've been working nationally with a number of partners called community-centered health homes. You can find more information on Prevention Institute's website. We have a whole write-up and a model that really speaks to this, but there's a case study that we outline in this publication, and it really kind of speaks to this idea of utilizing these partnerships, not just to focus on treatment, but to really think about prevention and how to get prevention to work in communities. There was an example that took place at a community clinic in LA a number of years back, and there was this child that came in with severe developmental disabilities. He couldn't lift his head, he couldn't speak, he couldn't walk, and they found that this child had pretty severe lead poisoning. And a group of doctors got together and they said, well, we have patients that are coming in and they have rodent bites, insect bites, there's skin rashes all over their body. And what they found was this wasn't just a public health issue or an issue that was just happening in the clinic. This was a housing issue. And so they were able to develop a partnership with the Housing Authority, a tenants' rights group, and put together a document, a policy rather, that outlined that there was not going to be substandard housing anymore. They were going to work with tenant rights and landlords to make sure that that housing was approved. And since this time, these clinics have been overseeing this process and making sure that housing has gotten a lot better for these folks. And significantly, there's been a decrease in the amount of children that have come in with these problems. So healthcare plays this really unique role in not just being able to treat disease, but if we really think about how many doctors and how many physicians are seeing kids come in each day with diabetic or type 2 diabetic or pre-diabetic conditions, or how many dentists that see tooth decay among children, these healthcare providers play a unique role in being able to address this in a really fundamental way in communities where they're able to use their expertise and their credibility with community members to really bring this issue to light and generate momentum around it.
And that really helps nonprofit organizations when we can partner with health professionals, because it gives us credibility in what we're talking about in our work, that it's not some high pie in the sky idea that we just sort of came up with, but there's actually a reason for the work we do. I would like to take a little bit also to the production side, so we can really use partnerships with farmers, with the farming industry, to get some better information and knowledge about, how does it really affect our health when we're eating meat that's coming through, farm factories versus grass-fed, when we're eating high pesticide or genetically modified foods. And I don't see enough research about that, and that's another long-term research, but there's definitely opportunities to partner with farmers and understand USDA and the healthcare industry or healthcare field, and a farm could be a really powerful partnership.
Great. Thank you. We have about 5 minutes for questions.
Is there support for organizations or farmers or food producers who want to shift into a better way of producing food? I feel like that within the next few years, there may be a case where demand actually outpaces supply, which is a good problem to have, but I've seen it doing salads where you literally couldn't get enough organic lettuce. What is kind of in the works for that?
Actually, USDA does have quite a number of programs to support transitioning farmers. There's a National Resource, NRDC, National Resource Defense Council. I think they also have grants that are available. There's a barrier to the farmers being able to apply for those funds because it's highly competitive, and they don't always have the command of the language and the process to do that. So there are resources to help with that. And shoot, there was another point, but I lost it. I'll say it later if it comes back to me. Oh, that was it. That organic is not the only certification, and so one of the things that we're trying to look at now is how do we sort of create our own certification that's sustainably farmed, that is not as, right now to be organic certified, the cost is about $5,000 a year, and USDA, you have to prepare these very intensive reports once a year for USDA, so it's a challenge for a lot of farmers. So we're trying to understand how can we really think, and this gets to the drought question as well, how can we really begin to understand healthier farming practices that are building soil, that are more sustainable over time. And there's a lot of university research on this. I think that would be another interesting partnership with healthcare workers at university to begin to promote soil building versus petroleum farming.
Hi, so you guys mentioned that transportation location is important. And I just read a while ago there was this center in the Tenderloin that was lost due to not agreeing on negotiations for art center and affordable housing. And I learned about it after the fact. And I'm just wondering, are you guys working on informing people how to get involved in creating these type of centers that are affordable and provide services to, like movement services, art services to people who can't necessarily afford it?
That's a good question. I think there are a couple ways you could enter the world of learning about what projects are going on. One would be the nonprofit route. So the San Francisco Food Security Task Force, for instance, has a lot of organizations that come to the table talking about the initiatives they're working on related to food insecurity. They meet, it's a public meeting once every month. They have a website. If anyone's interested, I highly encourage you to go. You can see Ramin, he's at almost every meeting as well. That's one way. Another would be to go to a local neighborhood community meeting. So almost every neighborhood has a neighborhood association depending on where you live. That's a good way to plug in and see what's happening. Probably for West Oakland, Dana would have some suggestions because the businesses or the nonprofits that are community based are also have a sense of who's doing what in the location. So that's another way of finding out what's going on.
All right, well, thank you all so much.